Seasonal struggle. While the holidays are a joyous time for many people, others have trouble coping. Research shows a significant rise in reported mental health issues between November and January. Claire Weber joins us now with what may cause this trend and how local agencies respond to the increase. Claire?
Bill, according to the American Psychological Association, 89% of U.S. adults say they feel more overwhelmed during the holidays. Local mental health professionals and first responders say they see that spike in incidents here at home.
If you can control anything, it's how you react to others and how you spend your energy.
Stress, grief, and anxiety are just a few things that can heighten during the holiday season. Michelle Park, a licensed professional counselor at Live Oak Mental Health Therapy Center, says an uptick in patients is typical this time of year.
Holidays are filled with expectations, and people have expectations for themselves, for their family members, and when things aren't met, it easily becomes very disappointed.
Park says prioritizing your needs is important during the holidays. This can range from making time to do something enjoyable from your normal daily routine to setting boundaries with what conversations you're willing to have with family members. And seeking professional help can make those choices less overwhelming.
Our life, and especially when we experience big things like trauma, it's not like a book where we just flip the pages. It is literally scattered about. And so putting those pieces back together can be really hard by yourself.
The Mount Pleasant Police Department's Community Wellness Unit also sees a rise in crisis calls around major holidays. Nearly 60 calls a month fall under this category, ranging from strictly mental health issues to substance use and homelessness.
That sounds like three separate categories, but a lot of times you're talking about the same person or somebody who ticks maybe two out of those three boxes.
Sergeant Stephen Kudron says officers' work doesn't stop after the initial call. The Community Wellness Unit conducts follow-ups both over the phone and at people's homes.
It might be a situation where somebody's okay right now, but they're kind of teetering. So we check in with them routinely just to see, okay, this is what things look like 2 or 3 months ago. What do they look like today?
Mount Pleasant police say their job is to safely de-escalate crisis incidents.
You're not in any trouble. We're here to help you.
The National Suicide and Crisis Lifeline can be reached at 988, both over the phone and by text. Claire Weber, News 4.